Good afternoon, everyone, and warm welcome to all esteemed guests, speakers, and participants who are joining us today for this important session on model in tobacco control. Basic theme and enforcement of anti-tobacco law, and we are discussing the experience from Gujarat today. So, we are welcoming our special guest and Dr. Jagdish Kaur, ma'am, Regional Advisor, Tobacco Free Initiative, WHO Regional Office for Southeast Asia, for agreeing to be a chief guest for this event. And I welcome Dr. Katira, State Nodal Officer from Gujarat, and Dr. Chirag Shah from Ahmedabad Municipal Corporations. I welcome Ms. Susan Samson, a Director from Faith Foundations, Gujarat, for sharing his practical insights into implementation of CODPA and PACA across various districts of Gujarat. So we may learn about the ground experience from Gujarat today, and using the innovative tools and involving the various government department, the engagement of various stakeholders. So that experience we are expecting from Susan Samson ma'am today. So, Dr. Rakesh Gupta, sir, I welcome you also to be a visionary leadership and to making this event happen. And thanks to Sanchika Gupta from Eco India for their valuable support. A special thanks and welcome to all the participants and attendees for your presence. Has made this session truly meaningful. We hope that discussion today inspire further actions toward creating a healthier tobacco-free India. So, before moving to first, I will invite uh, Dr. Rakesh Gupta, sir, to introduce our chief guest today's. So, over to Dr. Rakesh Gupta, sir.
Thank you. Thank you, Reggie. Uh, this problem with my laptop. Just let me correct it up first. Yeah,
You are audible, sir. Yeah.
yeah. Okay. So, good morning, all, and welcome you all. And today we are actually celebrating World Cancer Day. It is observed in February each year, and it serves as a global call to action in the fight against cancer, with an estimated 20 million new cancer cases and 9.7 million cancer-related deaths reported globally in 2022. Cancer continues to be one of the leading causes of the death worldwide. And as you are all aware that tobacco that causes cancer, and almost 30% of the cancers in India, they are related to tobacco, and almost 95% of the oral cancers, they are related to tobacco. And it can lead to lung cancer, it can lead to mouth cancer, throat cancer, esophageal cancer, pancreatic cancer, bladder cancer, kidney cancer, and cervical cancer. So we need to shun tobacco. And today we have with us as chief guest Dr. Jagdish Kaur. She is Regional Advisor Tobacco Free Initiative, WHO Regional Office for Southeast Asia. So you're welcome, ma'am. So we are waiting for your address. Thank you. Yeah, Dr. Jagdish, am I audible?
Yes, you are audible. Thank you
Okay,
so
okay.
much.
Okay, thank you.
Good afternoon, everybody. And I think thanks and congratulations to the organizers for organizing this very important session on the occasion of World Cancer Day. We are all celebrating in different contexts and capacities. We know that, like Dr. Gupta mentioned, that tobacco is a major risk factor for cancer and other main NCDs. And it's the main burden, of disease in most of the countries, including India. Like from 60 to 80% of the mortality happening from the NCDs, which includes cancer. So that is the main cause of concern, and India being one of the major consumers of tobacco. So starting from 2003, when CODPA came to India, the law came, then 2004, India ratified WHO FCTC, another commitment. So Government of India launched National Tobacco Control Program so that it was easy to meet the commitments under CODPA as well as the WHO FCTC. We have come a long way, a long path, a long journey since then. So much has happened, so many success stories, but challenges, they still remain. The main thing is that it is very important to have the law. There is a treaty, but enforcement implementation is an issue at the ground level, which cannot be, you know, accomplished without a lot of coordination, collaboration, partnerships with different stakeholders. Because at the ground level, it is very different situation. So we have been working along with different partners. There is provision for collaboration, in the law, in the program, in the treaty, how we go about it. So India has gone beyond FCTC, beyond law, having the bans in place, for smokeless tobacco, for ends. But then again, enforcement is an issue. We just keep looking at various violations and other things. Now the country is in the process to implement third round of the Global Adult Tobacco Survey and I think fifth round of GYTS. So we'll have the updated figures later this year from these surveys, and we'll know where actually we stand, after accomplishing so many things. Then what is the situation now? Because now it's no longer the tobacco epidemic. Now it is the nicotine epidemic. So it has transitioned over time. Industry has, you know, kind of, they are, like we always say, they're well ahead of us. So they have transitioned from tobacco products into the nicotine products, and especially the youth. So that is the global trend. In the region also, I mean, it has been there that it's most of the youth, they are taking up these new and emerging nicotine products, which is a challenge. So countries are coming up with different strategies and provisions. Like India came with the comprehensive ban, that's an example. But then we need to see that how that ban, it is actually getting enforced, how, it is having an impact. That needs to be seen, at the grassroots level, because children have still access to these products, and how they access, because somehow there are loopholes, somehow there are some deficiencies, and this access is still there. So that needs to be seen, that needs to be, kind of attended to, that needs to be kind of taken care of, and cannot be done actually only by the law enforcers. That has to be done in collaboration with everybody by holding hands with different partners. So I think we'll listen to Susan and see, what's being done, because Gujarat, being an example, is one of the good states with success stories. So, how they are doing, and high prevalence, also high burden. So let's see, because I think this series will be helpful to see, these stories from states, like which state is doing well. Also, then looking at the best practices. Okay, this state is doing, I mean, taking these additional steps. So how, we can also do that, or how some innovative ways to meet some particular challenges. So I think this is a good way to look at others, what they are doing, and how we are accomplishing different things, how we are meeting our targets, especially because NCD action plans targets and the larger SDG targets, now they are linked to it. We have FCTC as SDG 3A, that is one of the targets, and then uh, tobacco control, it's linked to almost 68 of the SDG targets. So we have to see that under the different SDG goals, how we can link it to the larger global goals, how we look at that, and how we take tobacco control, as a path to accomplishing the larger goals or commitments which the country has. So we say that as per the present trend, which was there, that we were, one of the countries to meet the NCD action plan target. But now I think when the results of the GATS 3 come, then actual picture will be there, and we'll be able to maybe revise the trends which we have. But I think that doesn't give us uh, a breather, that we can just relax, sit back, that okay, that is being done. But because there are so many challenges, it's a big country, it's such a different situation in each state. So we need to take that into account and keep doing our work with more efforts, more zeal, and continuing with our, I think, success stories, as well as meeting the challenges, how to do with that, learning from the regional best practices, the global best practices, how people have done it, the countries who have achieved that. People have, I mean, we speak of end game also, but I don't think, personally, that we are near to it. I mean, not at all. So this is a long way to go, but uh, I mean, there are some success stories also, which one of that we are going to listen today.
Yeah.
So all the best. Thank you so much. Best wishes from my end, and thanks for the opportunity. Thank you.
So thank you, Dr. Jagdish, and for your opening remarks. I think since you have a lot of experience in tobacco control, so you're the right person to be the chief guest. And we'll be learning from different states and from different regions about how they implement the law, including PICA 2019. So Susan will be actually focusing on how they implemented PICA 2019 in addition to the CORPA. So thanks a lot, and we'll like to listen to your concluding remarks as well. So if you have a meeting, you can just go to the meeting and then come back. Thank you. Thank you.
Thank you so much. Thank
So
you.
over to
I'll come
Rajiv,
back.
please.
Yeah.
Thank you. Thank you.
Thank you, ma'am, for your address. We'll move to next session, next speaker of the day. But before moving to there, I request everyone to switch on your video for some time. We'll take a screenshot for office purpose. And thanks to Sanjay Seth sir also joining us, Ramesh Gandhi sir for joining us. Thanks, welcome. And, I request all participants, please switch on your video for another 2-3 minutes.
So Rajiv, you can take the snapshots and then we can start. Madam Jagdish, if you're with us, please open up your video, please.
Okay, sir.
Okay.
Okay, so let's welcome our speaker of the day, Ms. Susan Samson. She is Director, Faith Foundation, and she completed Master in Social Work. She is working in the field of de-addiction, HIV/AIDS, tobacco control, women entrepreneurship, and empowerment since 2003. She has been awarded with the Best Youth for notable work in the rural youth in the year of 2006, and the Anti-Drug Hero Award by the Commissioner of Police, Vadodara. She is the member of Gujarat State Tobacco Control Cell. She is also member in Gujarat State AIDS Control Society, Barodara City and District Tobacco Control Steering Committee, and she is the national trainer for tobacco control. She had a project on tobacco control in all 33 districts of Gujarat in collaboration with the State Tobacco Control Cell and District Tobacco Control Cell. So over to you, ma'am, for your presentations today.
Hello. Good morning, all. Am I audible?
Yes, you are audible.
You are
And my
audible.
PPT is visible as well, right?
Yeah. So
Okay.
please make it in a slideshow mode. Yeah.
Okay, is that good?
It's okay. Yeah.
Yes. Okay.
So,
Very good morning once again. Dr. Rakesh Gupta, thank you so much for coming up with this innovative idea of sharing state experiences. And I'm more than honored to be presenting it alongside with Madam Jagdish Kaur from WHO. It's my utter sheer thrill to be experiencing this at such a nice national platform with other partners as well. So once again, and Rajiv ji, thank you so much. You've been kind to say such good words. Before I start, I actually, as we observe World Cancer Day, I want to bring in what history got us into tobacco control. Basically, 19 years back, 2003 and 4 is the founder, president of the organization, losing his father to passive smoking. And as we observe this day today, just 2 days back, I had a message from one of my dear friends saying that his father has gotten oral cancer due to smokeless tobacco consuming. And while we think that these are just statistics or data from Gujarat, from world around, from India, we are still seeing something that is so close to us, So this session becomes very not just informative in terms of what I have done as a de-addiction and tobacco control specialist in Gujarat, as in like intervening on demand control strategies and supply control strategies as well. But it becomes a very personal, challenging thing that, besides me working in tobacco control for hellish years now, 20 years, I feel that, enough work hasn't been done. So why? Because a close friend of mine and his father, I get a news just so recently, right? So we are seeing, just as Jagdish ma'am said, that we are seeing that the forms of tobacco addiction and how tobacco industry is coming up with new products is changing, and we are not just into tobacco control now, but nicotine control in a big way. So to begin with, this is the first initiative. I'm going to go into the history for the first 2-3 minutes and all the initiatives that we've done in the past 20 years, and then come up with our major initiatives which we've done in the past 6 months, including PECA, which is very phenomenal and unique for Gujarat, one of the only states who has been able to take up PECA. So we began this with only 18 students. We met the then Prime Minister requesting for stricter implementation of tobacco control laws in Vadodara and Gujarat with 5,000 signatories, students saying this. And since then, we have been training about 2,000 to 3,000 students each year on tobacco control. I just want to talk about the GATS fact sheet as well. Adult prevalence is 25.1 and student prevalence is 8.5 in Gujarat. So NTCP currently is implemented in all the 33 districts and all 8 corporations. We have been added with 9 more corporations in 2024 December, and we'll be extending our work very soon into the corporations also. Before I get into the work, and I have titled this as GO-NGO collaboration and experiences from Gujarat, because since the initiative or the establishment of National Tobacco Control Program in Gujarat, and even before that, it has always been an amalgamation of GO and NGO initiatives together. So the first, I will go section wise, talking about section 4 first. And before I do that, I want to apologize on behalf of Dr. Katira and Dr. Chirag Shah. They would not be able to join, and I'll be presenting on behalf of them, because we've had now a very administrative decision taken, and we'll have a commissioner for rural and commissioner for corporations, and there are some major decisions and some major meetings going on in the commissionerate at Gandhinagar. So to start with, talking about section 5, we had our Kotpa notifications since 2004 by the government of Gujarat, the first notification which gave powers to the Mamlatdars, TDOs, government offices, local health, and then we had additionals coming up in the subsequent years for the school teachers, for the sub-inspectors, for the constables. Of late, lastly, we also had for committee district level doctors also being given the authority to penalize and stuff like that. So in July 28, we had included the sub-inspectors as an authority to penalize.
Please keep yourself muted. All not presenting, please.
This was in 2022. Thank you so much, sir. This was in 2022 under Madam Dr. Jayanti Ravi, wherein all the government offices were mandated to put up this statutory warning, and including all CHC, PHCs, all the all the offices under the health system. In the GO-NGO collaboration, we were able to ensure 432, personally by Faith Foundation, 432 government buildings in and around Vadodara that had statutory warnings in their premises put up. We also took up panchayat villages, smoke-free villages way back in 2000. This is 2019 to 2021, wherein we were talking only about smoke-free villages with I think this 22, sorry, after Corona, 22, 23, after Corona, wherein one of the districts, taluka places, Savli, was made completely smoke-free village in an initiative with the taluka health officers and Faith Foundation, as an example to be replicated at the state level and the various district levels. This was the first 2014, wherein Vadodara Central bus stand, which was back then and which is still the most airport kind of a bus stand, which was made, the first bus stand that was made tobacco free by the state authorities in Gujarat. This is when hookah bars were banned. So way back in 2007, Vadodara had several raids done, several initiatives done by the Vadodara Municipal Corporation, Dr. Hitendra Patel, initiating the entire thing, followed in Ahmedabad and Surat. And then in 2016, an amendment was made in Kotpa for the ban of hookah bars and hookah parlors and the commercial sell or usage in the restaurants, ban on the same. So then this is about smoke-free and tobacco-free election booths that we have been able to do it in Vadodara and in Gujarat in 2019 and 2024, wherein the orders were given by the electoral commissioner for ensuring that the tobacco-free, the booths were tobacco-free, not just smoke-free, but tobacco-free election booths. To talk about ban on ends, well, Gujarat was one of the pro states that banned in August 2019 itself, which was approved by the assemblies, both the Lok Sabha, meaning the upper and the higher assemblies of Gujarat itself, and it was banned in Gujarat way back in 2019 August itself. So we had a signature campaign, and the signatures were then submitted to Chief Minister of Gujarat for the ban. This is also talking about tobacco-free, smoke-free tourist places, wherein we have been able to ensure that the beaches of Gujarat in the coastal areas are tobacco-free premises, tourist places. So talking about Section 5, we have been able to with the support from the local police, from authorities, and especially corporations, we had been able to work on radio ads which were banned after our complaints, especially Manikchand Oxyridge ads were removed from Marathon. These ads by Salman Khan were put up on point of sales called Daska Dham, which were promotional ads. If you buy 10 pouches, you could get a trip to certain place and stuff like that, which were banned. About 1,000 ads from Ahmedabad city. Pan Vilas, Pan Masala, POS ads and free sampling was done to students during the Navratri, which is a big festival in Gujarat, and there are lakhs and lakhs of students around, and they were free sampling this. This was stopped after our complaints and the commissioner's initiative or the commissioner's action in the city. Vimal ads and their hoardings, which are still coming up again and again. After repeated complaints, this becomes a very gray area where we are still trying to work upon. And of course, ads on buses. This was a notification way back wherein the Assistant Labour Commissioner of Gujarat, the Commissioner of Industries is authorized to seize and search in case of tobacco advertisements at non-point of sale, and also is authorized for mapping of advertisements and to take action against the complaint given by any agencies. So talking about 6A and 6B, we were able to, with the all district tobacco control cells, DTCCs, in all the 33 districts, we were able to draw a yellow line campaign, symbolic campaign in all the districts in year 2017 and 18, and we finished 16, and we finished the entire thing around January 2018 in all the districts. So, and this has been still followed as part of the TOFI implementation that is going on now. So as part of the TOEFL implementation, Jayaprakash Shivhare IS issued the letter which is being circulated to all the primary, to the commissioners, also primary, higher education and secondary. And now this is within the system that all of the districts are focusing in collaboration with the district education office and the DGCCs, that all the schools are on a auto mode going into TOEFL. This is one of the initiative which was very unique, called the Right for Tobacco-Free Generation, which was first done in 2021, wherein we had a cyclist going across 7 districts, covering up 525 kilometers, and giving the message of tobacco-free generation in the villages, performing at strategic locations, getting press coverages. We were able to get about 121 press coverages for the entire event. This was joined by various IS officers, collectors, and a tobacco-free generation when we took it up in Surat as well, wherein 135 schools were made TOEFL by 70 students in collaboration with the Commissioner of Surat and Surat Municipal Corporation in 5 days initiative. So, and the tobacco-free, also as part of the tobacco-free generation, smoke-free village, Savli was also taken up once again, wherein 47 villages, 56 villages and 47 schools were made tobacco-free premises. Part of the tobacco-free youth campaign, definitely we were able to get the health minister on board, and this is one unique initiative. I'm now going to get into the unique initiatives that we have taken up in Gujarat, and where district tobacco control cells have been very pro also. This is tobacco-free initiative, tobacco-free village initiative, which is taken up by District Amreli. I had I wanted the councillor himself to present, but I'm being engaged. I'll be presenting the same. So with the letter from the center, then the state order, and then the district orders, and the last one is at the Taluka health officer level. This was a very unique initiative taken up in a month almost, and in a single day on the 2nd of October, the 100 marks which need to comply for tobacco-free villages, all the points were taken care of. So this is in Gujarati, but I'm going to translate it. There were about 600. So all the 603 villages were including, meaning engaging all the administrative offices, Panchayati Raj institution, PHCs, ASHA workers, NGOs, farmers. So all of these were there in the entire campaign that was done at every village level. So village level coordination committee, 603 village level coordination committees have been formed in that district. And each village has an ambassador. Also, they have been mandated to conduct 2 programs in each district, each village, which has been done. A resolution has been passed in each of the villages, and to conduct entire campaign, calculated of 18,847 people were involved, which includes the Sarpanch, ASHA workers, the school authorities, the farmers, everyone in the village level. So this was one of the very unique initiatives which was taken up last year. These are the press notes of the same. Ahmedabad Municipal Corporation has been, as part of the tobacco-free youth campaign also, and last year we were, when we were going through the various districts that had tobacco growing villages and districts, we took up an initiative, and this year, every single day, Ahmedabad Municipal Corporation, Dr. Chirag Shah was to present that as well. Every day there is a collection enforcement raid that goes on after that initiative that we took up together with Ahmedabad Municipal Corporation. So talking about PECA implementation, and which is the focus or the most unique intervention of Gujarat, 3rd July 2019, we introduced the law of banning e-cigarettes by the health department as well. Going from that 5th December, 26th Feb, there have been various raids. Now, what is unique about this is that once we had a directive from the Minister of Home, Harsh Sanghvi, e-cigarettes has been his orders were also for other drugs and all the products to be seized, and these were seized from Kandla port, these were seized from airports, these were seized from shops by the revenue department, by the home department, by the SOG, by the local police, and till 2024 2nd September, we have been able to seize about more than e-cigarettes of more than 70 crores. And this has been the most unique intervention that was taken up, and we are constantly following up with the DRI from Surat, DRI Rajkot zone as well, and also the various SOG of the corporations or various SOGs that are falling into the jurisdictions. Followed by this, of late, recently we have been able, on the 28th of November 2024, we had a SETCOM that was done for TOFI implementation, which was a state level thing done with the state STCC, Education Department, state, meaning Commissionerate, both the departments at the state level, and Faith Foundation, wherein all the schools that fall under the secondary, primary were addressed at one lecture, one SETCOM that was organized on TOFI. And now we are also having a monthly reporting system wherein all the DTCCs and DEO offices are reporting on how many schools have been made TOFI. We are very positive about being able to achieve about 80 to 90% of TOFI schools being done in Gujarat by this fiscal year, meaning by March 2025. Attended by Dr. Katira, obviously, and from the Education Department as well. So this is one of the, and Dr. Rakesh Gupta holds credit to this as well, giving me an idea that something like this could happen. A 12 series webinar for all the councillors in Gujarat that we were able to do to enhance the knowledge component for officials at the district levels. This is our order on FCTC 5.3. This was a work to get an order of FCTC 5.3 and an vendor licensing order. This is our state orders, 2 orders. It was a work of almost 2 years. We had to present files after files to various departments, convince them, talk to the government officials. As a CSO, we would go down, and our State Tobacco Control Cell officials would support the entire thing. And we were able to get this after 2 years of intervention and various meetings with various departments and officials. We are now trying to get this implemented at the district levels, and especially FCTC 5.3, and also vendor licensing at the corporation and district levels also. Whether various other initiatives that we've been able to take up in tobacco control, obviously our report releases. We've had the fortunate of working with WHO on alternative crops and addressing the farmers during our Right for Tobacco-Free Generation, which went across 7 districts on the tobacco growing districts and talking to the farmers. And also we have worked with BD rollers and alternative skill trainings in the year 2018-19, which still goes on. We were able to intervene with around 90 to 120 BD rollers whom we trained on alternative skills. As an organization, we have also been interveners in PILs on Section 5 and statutory warning in films long back. It was our humble and honor to be felicitated by the Honorable Minister of Health, Gujarat, for our notable work in tobacco control and in health when we supported. So there was this case which came up in Gujarat where a blue baby was born, and the blue baby was born because the mother was consuming tobacco. And hence we took up an initiative in various tribal belts where the women consume tobacco, and we provided them with nutrition kits, regularly monitoring their HB levels. They are counseling them on the harmful effects and following up them for almost 2 or 3 trimesters of their pregnancy. And this was on the right side is our right for tobacco-free generation. Second, which we had done, and we are hoping to also go in for a right for tobacco-free generation. Third, in the month of May. Obviously, a way ahead is smoke-free corporations, all 8 corporations by month of May. We are looking forward to tobacco vendor licensing, and also one initiative at the state level, which we are taking up with Panchayati Raj institution, is all the villages in Gujarat going tobacco-free villages by next year possibly. So we are also having talks on the same. Our COTPA amendment is in, okay, I haven't written that, but our COTPA amendment is in process, and we are, it is in the legal department of the Home Ministry. So we are hoping to get an amendment in our COTPA law in Gujarat very soon as well. So these, in brief, have been our initiatives, and I look at it as GO-NGO collaborations, because every time when we went to the state authorities or the district authorities or the corporations as watchdogs or as whistleblowers, whenever we gave complaint, there have been challenges, there have been questions, there have been delays, there have been oppositions, but we have seen that, you know, when we work together to support the tobacco control program, in the end it works out favoring, you know, the health of the or the interest of people or of the masses. So once again, I hope I'm not missing out any. Yes, okay. So that is from my side. Thank you, Dr. Rakesh Gupta, for giving me this platform, and I'm open to questions or suggestions or ideas that we can still implement in Gujarat. Thank you so very much. Thank you.
Thank you, Susan, for your very elaborate presentation. And we know that as an implementer, actually, I know that it is very difficult to implement the laws in India. And we have experts with us who will be asking you questions, and they'll be commenting upon your presentation. So we have Dr. Rana with us, Dr. Rana Jaising, Mr. Sanjay Seth, Ramesh Gandhi, Jail Thomas, Mr. Casey Sani is also with us. So they'll be asking you question and giving comments about your presentation.
Sure.
And it is an excellent presentation, I must say.
Thank you.
And I request you to please share the presentation in PDF form, if possible.
I will do that.
For our annual report. So thanks a lot. Thank you.
Thank you, sir. Thank you. I'll do that. Thank
so
you.
You can stop sharing, and then we can ask all to please comment.
Ji, sir.
So Dr. Rakesh Gupta is also with us. So namaskar. So Dr. Jagdish is with us. She has returned. So Dr. Jagdish, will you like to comment upon the presentation before others or after this?
I think after this, because sorry, I missed, you know, I had to leave in between.
Oh, it's all right.
This. Okay.
So we'll listen to the comments of others then before you comment.
Yeah, thanks.
So Dr. Rakesh Gupta, yes. Very brief comments, just 2 minutes each.
Thank you very much for the opportunity. Susan, you have made a very elaborate presentation, although I missed the early part of it. Whatever I heard, it's been very informative. Your canvas of activities is very vast. And so congratulations for all the achievements.
Thank you.
Tobacco-free generation has been something which has been of interest to me, and yes, that you have done some work, but you're not given the concept as to what is your concept of tobacco-free generation. Are you associating it with tobacco-free educational institutions?
Yeah, currently it is with TOFI, and we look forward to have a state tobacco-free generation policy as well. So we are proposing it in the state SLCC very soon, and it will be in lines with what all of our partners are working, OP and you as you've been doing in Rajasthan. So currently it is associated with TOFI.
No, because conceptually tobacco-free generation means
is a wider concept.
Is a birthday restriction for the people who will be presenting. So does your policy mention about the birthday restriction, the date in particular after which the children?
No, sir. We are actually in the process of getting the policy yet. So this is in the formative stage as a state policy yet. So we are working on it. So it is going to be proposed in the state SLCC very, very soon now. So we do not have a date currently decided. Yes.
Okay. I'll be happy to see the draft if you prepare.
Yes, sir. I'm
can
going to
refer
run
to
it through you. I'm going to run it through you definitely.
refer to our paper, which has been published in Tobacco Control recently.
Yes, definitely. I'll be running it through all of those experts who are there in the paper. Yes.
Thank you.
Thank you.
Thank you, Dr. Rakesh. And we have with us Mr. Ramesh Gandhi. So let us listen to him also. Yeah, thank you. Ramesh, you are muted. You are muted.
Audible now?
Yeah.
Yes. Good afternoon, everybody. Thank you, Dr. Rakesh Gupta ji, for giving me this opportunity to put my question. Just a moment, sir. First of all, Ms. Susan, thank you very much for a very enlightening presentation and very comprehensive work which you have done in Gujarat. Is a learning thing for every NGO.
Thank
My
you, sir.
question is that when you started the work in Gujarat in collaboration with the government, so did you enter into a formal MOU or agreement kind of a thing? Or it started just like on ad hoc basis and on project to project basis and it went on? So what was the journey regarding the formal, how this formal relationship started? So that this question, so that other NGOs can learn. And the second question is that you have done so much of work. So how do you mobilize resources, means financial resources? Have you got some grants or you manage from your own resources?
Well, sir, okay. To answer first, I believe that the entire tobacco control program initiative in the country of India is a matter of passion run by individuals who believe that tobacco control karna hai karke. Just like Dr. Rana doing it with so much of passion, CSOs do it even more. Definitely our formal initiative or formal work with the state governments started when we started working with union. And vital strategies now. So now we have a formal MOU with the state, but since 2003 till almost 12, 16, we were always on an ad hoc basis. So it was our personal vision as an organization, because I'm also a tobacco de-addiction specialist, and tobacco happens to be a secondary addiction. But I believe that, again, I would reiterate that we are a bunch of passionate people who want to see a tobacco-free generation. And that's why all of us are working, whether with money or without money. We will always be doing this. I mean, I believe Dr. Rakesh Gupta will definitely agree to this. And most of us are not funded huge, always and every time. But yes, now with vital strategies, we've been able to support the national tobacco control system also, in the state also and in the district as well. So yeah, we have grants from Vital right now. Yes.
So now you have entered into a formal agreement. So
yeah, we are in a formal agreement with the state
so does
as
it define
well.
the scope of work also, that in what areas you will be working, whether tobacco-free, tobacco vendor licensing or toffee, or it defines the scope, or it's open from the scope point of view?
I believe, no, we within this project, we definitely have allotted things that we want to do, but there's always scope for more. Just as Dr. Rakesh Gupta in his introductory was saying, we are not going to be restricting to tobacco products now. We have to move on to nicotine products, and we have to be exploring that arena as well. So obviously there's a scope for more. And I said that, if I feel, so there was one agency that approached us because it has a nicotine supplying unit here in Anand. Gujarat itself, and they supply it for the pouches in Sweden, and they wanted to do some work. So that doesn't fall in the scope of the project, but of course, nicotine products, and which are upcoming products, and we did whatever best we could do to support the agency who was looking to explore more on the idea and stuff like that. So yeah, we are open to other kind of tobacco products or challenges that come up. Yes.
Thank you.
Ji.
Susan, I'll suggest that you also start working on nicotine pouches, which are available.
हाँ जी सर, Zello वाला प्रोडक्ट ही उस पे ही
वो
तो
भी
हमको
हाँ, और उसके against Drug and Cosmetic Act is still effective, and that can be used very effectively. Yeah.
ठीक sir. Because
So
that's
we
coming
have
from
with us Dr. Siddhi also. So Dr. Siddhi, do you have any question? And after that, anyone who wants to ask questions, they can just unmute themselves and ask questions, please. Or they can put it in a chat also.
Yes, sir.
Mukesh,
Sir, regarding toffee and all sessions where, institutional areas which have to be banned, I could see near hospitals, near schools, near colleges, many people who had toffee, pencil, pen, books, and eateries, they also had to sell tobacco products. So that thing is might be NGOs are working for that, but it is actually in ground, maybe in semi-urban and village areas, it is very much prevalent, and definitely this has to be taken up more over by legislation. That is my view.
Yes, ma'am, I agree. So, ma'am, we as a de-addiction specialist, we also always work in supply reduction and demand reduction, both the strategies going together. So I believe that is one way we need to see that while we create more of awareness, we will always have to keep upgrading our policies and our notifications and our laws, So definitely, I agree on that as well.
As Dr. Rana said, who should get license and who should not get. The primary who should not get, that has to be seen in our view.
Yes.
Because it is widely prevalent.
जी sir. जी ma'am, बिल्कुल.
So thank you, Dr. Siddiq. So I think Dr. Rakesh Gupta has raised hand. So let us ask him and then we'll proceed to a formal vote of thanks. Thank you.
brief
Yes,
question
Dr.
to
Rakesh
you.
Gupta.
My brief question to you is whether nicotine pouches can also be covered under PACA 2019.
No, they cannot be covered. Actually.
No, sir.
Only electronic devices, they are, as at present, they are covered. Only the electronic devices. That includes the heat not burn products, but not nicotine pouches. Nicotine pouches can easily be covered under the Drug and Cosmetic Act. And I have actually personally talked to a formal state drug controller of Haryana, and he is of the view that it is easily covered under Drug and Cosmetic Act. Yeah.
I remember this discussion, sir. Yes.
Okay, thank you. Yeah. So thanks a lot, all the experts who have given their final comments and have asked questions. So we'll just proceed to a formal vote of thanks by our intern, Ms. Tamanna. And yeah, thank you.
Good afternoon, everyone. On behalf of the organizing team, I extend my heartfelt gratitude to all the participants for being part of today's webinar. First and foremost, I want to extend my gratitude to Dr. Jagdish Kaur for sharing her expertise on advancing tobacco control policies, to Ms. Susan Samson for sharing her experiences on enforcement of QOTPA and PECA in Gujarat, Dr. Rakesh Gupta, President and Director of Public Health Sipher, for his visionary leadership and invaluable insights that set the tone for today's session, to Dr. Sanjika Gupta, ECO India, for her technical support. A special thanks to Mr. Rajiv Kumar, Project Coordinator, PGI Chandigarh, for welcoming the participants. And I also want to thank the experts, Dr. Rana J. Singh, Sanjay Seth, Dr. Ramesh Gandhi, Dr. Rakesh Gupta, KC Sani, and Dr. Siddhi for their educating remarks. And to all the participants and attendees, your presence and engagement made this session truly meaningful. We hope today's discussion inspire future actions toward creating a healthier and tobacco-free future. Thank you all once again, and let us continue to work together toward impactful change in public health. Thank you.
Thank you.
So thank you all. Thank you all.
Thank you so much.
Thank you. Bye.